Hi, my name is Ashley Larkins, and my handler today is Lynn, and we're going to be using our horse here is Chester. Today, I'm going to be talking to you guys about how to do a horse health check. So the first thing that we want to consider when we're talking about our horse is that we want to know what our horse's normal is, whether that's behavior, visual, or on the several tests that I'm going to run. We want to know what our horse is usually like, because if we don't know what our horse is usually like, we won't have anything to compare to. So first of all, what I'm going to do is I'm just going to look at my horse overall. Is there a shine in his eyes? Because if his eyes are dull, then that can be an indicator of pain, or that he's not feeling the best, or that he's a little sick. Another thing that we want to look at is his coat. Is his coat shiny, or is it dull? If his horse's coat is dull, it could indicate that he's not feeling well, or maybe his nutrition levels aren't where they need to be. Next, I'm going to walk around the entire horse and just look and feel with my hands for any wounds, cuts, lumps, bumps, anything like that that would be abnormal. So I'm just going to start up here at his neck and just keep looking over him. And I don't notice anything abnormal on this side, so I'm going to cross over to the other side. My handler, Lynn, is going to come with me for safety reasons, so that whenever we're on this side of the horse, she can pull his head towards us and thus take his hind end away from us to avoid getting kicked. So again, I'm just running my hands down, checking for anything unusual. Good, and I don't see or feel anything unusual in Chester, so I've now done a visual and a hands-on overall look at him to see if anything's wrong with him. I've also taken and note his behavior. One thing to consider about the behavior, when you go to get your horse, if your horse usually greets you at the front of the stall and suddenly he's standing in the back with his butt towards you, that could indicate that he's not feeling right. So the first test that we're going to run today on Chester are a couple of tests to check for hydration. The first thing that we can do is we can check his mucous membranes. There are two places to check the mucous membranes. The first is the gums on top or below the teeth, and the other one is inside the eyelid on the conjunctiva. So they should have a normal pink and moist texture to them. If they are a different color, like say yellow, that can indicate a liver problem. A pale or blue color can be anemia. White could be shock. Fiery red could indicate a fever. So it's just important that we know that some of these colors could indicate that there's a problem with our horse. If it's not moist, then that also could indicate that our horse is dehydrated. So in order to check his gums, I'm just going to let him know that I'm here. And then I'm going to just gently open up his lip here on the side. And I can see right here the nice pink color, and I'm just going to feel, and they are indeed moist. The other place that I can look for them, or for the mucous membranes, is in the eyelid. I'm not actually going to pull his eyelid open here, but if I was going to, I would just place my middle finger on top of his eyelid, my thumb on the bottom eyelid, and I would just peel the eye open and look down at that liner in the eye to see what they're looking like. The next test I can do on the mucous membranes that also tests for hydration is what we call the capillary refill. The capillary refill is essentially putting pressure on the gums, so we're going to blanch out the blood supply to that area for a short time, 1 to 2 seconds. And then we're going to release that pressure, and we're going to see how quickly the blood comes to that area. So I'm just going to, again, come up here beside him, let him know that I'm here, and then I'm going to open up his lip, push my finger in for 2 seconds, release, and watch the color fill back in. And the color did indeed fill back in the normal 1 to 2 seconds. If it's longer than that, then I could be concerned that my horse is dehydrated. Another dehydration test that I can run is the skin pinch test. The skin pinch test is just going to check to see if the horse is hydrated. What I'm going to do is I'm going to pinch a little bit on his neck or shoulder. You can also do this on the eyelid, but most people just do it on the neck or shoulder because that's easier and more comfortable for the horse. So what I'm going to do is just pinch up a little piece of skin, and then I'm going to let it go and see if it returns in 1 to 2 seconds. If it doesn't, this could indicate that my horse is dehydrated. I do, however, want to keep in mind that older horses lose elasticity in their skin, and it's very possible that theirs might take a little bit longer. So if I have an older horse, I definitely want to know the normal, and if for some reason it is a little slow, maybe I should go back to my mucous membranes and the capillary refill and do another check to make sure that I am indeed seeing that he is dehydrated. So I'm going to come over to the side on him, and I'm going to just grab a piece right here in front of his shoulder where the skin is nice and elastic. I'm just going to lift it up and let it go, and it does indeed return in 1 to 2 seconds. The next couple of tests that we are going to run are going to be our pulses and our heart rate. So our pulse range, the normal range, is 32 to 44 beats per minute. We want our horse sitting somewhere in that range. If we have a high pulse rate, that could indicate that our horse is in pain or having an issue with some kind of an illness. If it's under the 32 beats per minute, then that could mean that he is in shock. So to check our pulse, there are 3 different locations that we can check our pulse. The first one is the external maxillary artery that's located underneath the horse's jaw right here. So what I'm going to do is I'm going to take that one first. I'm going to have someone time for me. It's good to have someone time for you because I need to focus on counting the beats and not on the numbers that are happening on the timer. So I'm going to have my friend Morgan here time for me. I'm going to time for 15 seconds, and whatever number I get in 15 seconds, I'm going to multiply that number by 4 to get our beats per minute. So I'm going to find it, and when I locate it, I'm going to then tell my handler, or tell my timer that I'm ready. Oh, sorry. He kind of jolted there. Yeah. Ready. Okay. Stop. Okay. So I counted 10 there. So 10 by our 4 is going to be 40, and that is sitting in the normal 32 to 44 beats per minute range. So he is normal and happy. The next place that I can check is going to be the radial pulse, which is located on the inside of the back of the knee. So I'm going to be careful because I'm going to let the horse know I'm here. He might pick up his foot, but I'm just going to let him know I'm here. I'm going to squat, I'm never going to sit or put all of my weight down. I'm going to make sure that I have at least one knee off the ground so I can get away if I am to encounter any trouble. And then I'm going to just run down to the inside of the back of the knee to find the radial artery. Ooh. And when I find it, I'm going to have my timer time for me again, so I'll tell you when I'm ready. Ready. Start? Yes. Stop. And I again got the same as up here at our maxillary artery. I got 10 beats, which is again going to be our 40 beats per minute, which is going to make sense because we want the pulse to be the same, especially since I just took it, so it should be the same number. The third place that I can check the pulse is the digital pulse. Now the digital pulse is a little different than our past 2 pulses because we don't want to feel a digital pulse. A digital pulse would be indicative of some really serious food problems, like perhaps an abscess, or if he was foundering or was having the starts of laminitis. So to feel the digital pulse, I'm going to again come down, squat next to my horse, making sure he knows I'm here, and I'm going to run my hand down. I'm going to be aware that he probably is going to pick up his foot, so I'm not going to get upset at him for that. And then I'm just going to run 2 fingers on the inside, 1 finger on the outside, just below the fetlock joint until I find that little squishy area. I'm just going to feel around a little bit. If I feel anything, it's going to be pretty hard to locate. I'm not feeling anything, so I'm going to go ahead and check the second area, which is just to run my fingers down right here on the inside of the cannon bones. And I'm still not feeling anything, which is a good thing. That's normal that I wouldn't feel a digital pulse because Chester here doesn't have any hoof problems. So that's our pulses. You can check any of the 3 areas that I just explained about. So next we're going to move on to checking the heart rate. So I'm going to grab a stethoscope. Now to check for our heart rate, we're going to look on the chest wall just behind the elbow on the horse. And I'm again going to have my timer time for me for 15 seconds as soon as I locate his heart rate. When you're ready, go. Stop. Okay. I again counted the 10 beats there, so then that would be our 40 again. 40 beats per minute, which is good because it did align with our pulses. If our heart rate was high, we might again be indicating a pain or an issue there. So the next thing that I'm going to check for while we have our timer here is our respiratory rate. To look at our respiratory rate, I'm going to face the hindquarters so that I can make sure I don't get kicked. My handler is watching to make sure I don't get bitten. And I'm going to stand nice and close to him, keeping my hands on him, just so he knows that I'm here and I'm not taking him by surprise. What we're looking for, and you can kind of see here, is just the in and out motion that his flanks are moving. So it's out, and then it's going back in, and coming out a little bit again. So the normal is going to be 8 to 16 beats per minute. Because we're dealing with a little bit of a lower number from our 32 to 44, I like to use 30 seconds so that we have a little bit longer to get an accurate reading. I also like to place my other hand at the top of the flank. That way I can see and I can also feel in case I might miss something. It's just a good way I feel to check myself. So I'm going to find it, and whenever you're ready, timer, go. Stop. Okay, so I counted 5 breaths that he took in that time. Since we did 30 seconds, we're going to multiply that by 2. So he took 10 breaths per minute there, which is in the normal range from 8 to 16. If he's taking more breaths than that in a minute, then he could be in pain once again or have an issue dealing with some kind of an illness. So another thing to note when we're talking about a respiration rate, some people will take it by the nostrils. The nostrils can be really misleading though, because the horse can sniff you, or that's how he shows that he's curious. Like if you put your hand out to a horse, he's going to kind of turn and he's going to flare his nostrils, and that's going to make your reading really inaccurate. So I like to stick with the flanks because it's a better, more accurate reading. Another thing to notice is that if our respiratory rate is higher than our heart rate, we have a very serious problem, and we're going to want to contact our vet immediately. Next, I'm going to take the horse's gut sounds. The gut sounds are especially important if we're afraid that our horse is colicking. There's a couple of things that we want to be listening for. There are 4 quadrants on the horse, an upper and a lower on both sides. It's important to listen to every single quadrant because everyone is individual and can have different sounds. One quadrant might be perfectly normal and another one might be having some serious issues. So we want to make sure we listen to all of them. Normal is going to be a lot of good gurgling sounds, lots of noises, busy in there, that kind of thing. The two issues we might encounter are no sounds or very, very quiet, which is a very serious problem. That could indicate that there's a part of the bowel that's not functioning, or there's some area of the bowel that blood supply is not getting to. If we have a lot of really rushing water, like a hurricane coming in, really loud, watery sounds, that could indicate hypermotility. That also is cause for concern, but not as much as if there are no gut sounds. So what I'm going to do when I'm listening to my gut sounds is I'm going to again approach my horse, let him know I'm here, facing his hind end so I don't get kicked, hands on him, feet not underneath him so I don't get stepped on, and I'm going to walk up and approach him, and then I'm just going to lay my ear on the upper quadrant, and I'm just going to listen. Good. Several good gurgle sounds there. And I'm going to now listen to the lower quadrant. Also some really good gurgle sounds. I'm going to have my handler turn him around, if she will, so we can listen to the other side. And while she's doing that, as you notice, the gut sounds are right near the flank area where I was just taking them, and that's where we're going to listen to the quadrants. We could also use a stethoscope if we wanted to, and if the environment was one that was loud and we needed a better hearing aid. While we're in the nice quiet barn, I prefer to just use my ear. So I'm going to turn around, approach my horse. Again, feet not underneath him, hands on him, and I'm just going to lay my ear in the upper quadrant on his flank area, and I'm just going to listen. Good. There's some good gurgles going on that area. Then I'm going to listen to the lower quadrant. Oh, buddy. Good. Really loud gurgle there. And as you can see with my hands on him, that's going to tip me off to when he's going to move away from me, and it's going to be a lot safer. So I know if I need to move with him or back off completely. So I hear some nice normal gut sounds in there. Everything sounds great, and so I can tell that he's healthy and we're not having any colicking issues. The next vital sign that I'm going to take is our temperature. The normal temperature for the horse is in the range of 99.5 to 101.5. 102 and above is going to indicate a fever, with the normal temperature being at 100.4, but anything in the range is great. Alright, so what I have here is a digital thermometer. We could also use a mercury thermometer. A mercury thermometer can sometimes be a little bit more accurate because you don't have the added conflict of batteries. But if you're using a mercury thermometer, you want to make sure that you shake it down well past 98 so that it's going to be a good normal reading for you. With my digital thermometer, I don't have to worry about shaking it down or anything. I just need to make sure that the batteries are working properly. With any thermometer, I want to have some kind of a lubricant so that we don't hurt the horse, or it's a little more comfortable for the horse. So I have here petroleum jelly. You could also use Vaseline or any kind of lubricant like that. So I'm just going to take off my lid. I'm going to get a little bit on here, coat it nicely on the tip. And I'm going to insert this rectally. I want to insert it into the horse's anus about 2 to 3 inches. And I want to hold it for about 2 minutes. So if I had a mercury thermometer, I would need to time that. If I don't have a mercury thermometer, the digital one will time it for me. So I'm going to make sure I stand to the horse's side, and I'm going to keep my hand on him here, letting him know I'm here. I'm going to want to pull the horse's tail out into the side so that I can insert this into his rectum. So I'm going to turn the thermometer on, make sure it's ready to go, and then I'm going to insert it in, and then I'm going to push the button so that it starts timing, and then I'm just going to wait for it to take the temp. And when it's finished, it should beep letting me know that it's finished. Good, and then it beeped, so I'm just going to pull it straight out. And he had a temperature of 100.1, which is right in the normal range for him. And so I'm going to just, when I'm done with my thermometer, I'm going to wipe it off with a towel, maybe use some rubbing alcohol on it before I use it on another horse, just to make sure that I'm not passing along anything from the other horses. So what I've talked about here today is what we can do to determine the normal for our horse. So you want to run these tests routinely on your horse so you know what the normal is for your horse. That way if he's acting a little strange or you notice something strange in his behavior, you can catch the illness right away so that it can be fixed. Especially with colic, it's really important that you catch it right away. You're going to have better odds just getting your horse healthy that way. So we talked about our capillary refill, our mucous membranes, our skin pinch, our pulses, respiratory rate, heart rate, temperature, and gut sounds, which are all tests that you can run on your horse, and besides our general appearance and just our visual on him. So this is how you do a horse health check.